Thank you very much for the introduction, and hello everyone. My name is Marc Santos, and I'm a PhD student at the University of Toronto. So just quickly, some disclosures. Dr. Clairvaux-Hininen owns a company that is commercializing the ultrasound systems that are used in these experiments, and I've done paid work for that company, and this work is kindly funded by the Focus Ultrasound Foundation. So for a little bit of introduction, as was discussed in some of the talks earlier today, glioblastoma multiforme is one of the most common and deadly brain tumors known to humankind, and it continues to have a dismal prognosis, unfortunately. In Canada, the average survival for GBM patients is less than 1 year, so this really highlights the clinical need to find more effective treatments of this tumor indication. So it's been shown, thermal ablation of tumor tissue has the potential to stimulate an anti-tumor immune response, and as most of us here are aware, MRI-guided focus ultrasound has advanced to the point where it can now create thermal lesions within human brain to the intact human skull without the need for surgery or anesthesia, and so it follows that it could be possible to thermally ablate a GBM tumor in a human patient, simulate an anti-tumor immune response that could then be augmented with different immunotherapies such as immune checkpoint inhibitors to improve the treatment outcomes for patients with GBM. And so that's kind of the hypothesis that we wanted to evaluate a little bit in a mouse brain tumor model. So we performed experiments in immune-competent mice with an intracranial GL261 glioma tumor model, and these were implanted following a craniotomy preparation. So we removed the top part of the mouse's skull in order to allow the ultrasound energy to be deposited more efficiently into the brain tumor. These tumors were allowed to grow for 14 days, or about 2 weeks, whereupon the experiments commenced. And our ablations took place within a small bore 7 Tesla MRI scanner, so we could acquire real-time MRI thermometry images during our sonications. And we achieved our ablations with a single element spherically curved transducer with an F number of 0.8, driven at its 5th harmonic. So we sonicated at a frequency of 5.5 megahertz in order to try to reduce the far field heating. And I'll talk about that a little bit later, but we sonicated in continuous wave for 15 seconds at about 2.45 acoustic watts to achieve ablations. And we compared the tumor volumes that were measured on day 14, whereupon the animals were either treated with an ablation or a sham control with no sonication. And we let the animals recover, and then we would image them again 1 week later on day 21, and we would compare the tumor volumes and the tumor growth between the 2 different groups. And also on day 21, we would sacrifice the animals and perform immunohistochemical staining in order to assess the immune response, looking at H&E stains to delineate the tumor boundaries, and then we would count the CD4 positive and CD8 positive cells within the tumor boundaries for comparison between the 2 groups. And so we were able to achieve our ablations with our sonication scheme for 15 seconds at 5.5 megahertz, and this was verified with the thermal dose calculations from the MRI thermometry measurements. In a subset of animals, it's important to note, this is kind of a technically challenging situation. The skull base was overheated, as indicated by post-treatment T2-weighted images that showed hyperintensity or edema, which is indicative of damage away from the area that we were trying to heat. And I'll talk about this a little bit more in my next slide, but just going on to the tumor volume results. We observed slight tumor debulking effect, which is not necessarily surprising because we were ablating or thermally coagulating a small portion of the tumors, which then follows the tumors and then grow more slowly, which is what we observed compared to our sham or untreated controls. And also looking at the CD4 and CD8 cell counts within the tumor boundaries, we saw a significant increase in the cell density of CD4 positive cells in the tumor sites, but we did not see the same increase in the CD8 positive cells. So kind of to wrap up, our MRI-guided focus ultrasound ablation has shown preliminary potential for eliciting an anti-tumor immune response against an orthotopic tumor model of GBM in mice. Ablation of mouse brain tumors is technically challenging due to the small spatial scale of the mouse brain and the presence of the skull. And so we would recommend using focus transducers at higher frequencies, and I would probably recommend using a lower F number than we use here. So we used F number 0.8. You might want to reduce the F number if you're using a single element transducer, or potentially a more sophisticated phase array geometry to try to reduce the unwanted heating effects in the skull base of a mouse. And so what we found from our immunohistochemical analysis was a significant increase in the CD8 positive cells, but that doesn't necessarily tell the whole picture or tell the whole story about the immune response in this case. So we're also hoping to complete some flow cytometry measurements as well to gain a more complete understanding of the immune response following this treatment, and to kind of evaluate whether or not this may be a potential combination therapy with immune checkpoint inhibitors to treat GBM in patients. And so with that, I'd just like to thank all the members of the Focused Ultrasound Lab at Sunnybrook Research Institute, specifically Dr. William Cruz and Jennifer Yee, who helped a lot on these experiments. And I'd also like to thank the Focused Ultrasound Foundation for funding this work. And with that, I'm happy to take any questions. Thank you for your attention.
Any questions? You mentioned doing a craniotomy to remove the effects, but for a mouse skull at 1 megahertz, at least my experience is it has a very small effect. So how much effect would you expect the mouse skull to have at 1 megahertz?
So I should apologize. In the diagram that I showed, I said F0 equals 1 megahertz, but that's just the fundamental frequency of the transducer. We drove the transducer at the 5th harmonic, so we were actually sonicating at 5.5 megahertz, at which case the absorption was quite significant, and we weren't able to get
That
anything.
makes more sense.
Okay, if there's no more questions, thank you very much.
Thank you.